Hello, everyone. We will talk today about evidence-based medicine. And to start, imagine that you walk into a patient consultation or a multidisciplinary team meeting, and you're faced with multiple choices, different treatments, diagnostic tests, or approaches that are available for patient care. Each option has compelling arguments, some supported by data, others backed by experience. The question is, how do you determine the best path forward? This is where evidence-based medicine becomes essential. Evidence-based medicine is not only an important concept, it is a disciplined approach to decision-making in healthcare. It's about combining the most current and reliable scientific research with the expertise of clinicians and the values and preferences of patients. This framework empowers healthcare professionals to deliver care that is both effective and deeply personalized. In today's session, we'll explore what evidence-based medicine truly means, why it has become a cornerstone of modern healthcare, and how it transforms patient outcomes. We'll break down its core principles, understand the hierarchy of evidence, and discuss the critical thinking skills required to evaluate and apply evidence effectively. Think of this session as a conversation rather than a lecture. Evidence-based medicine is not about memorizing studies or blindly following guidelines. It's about developing confidence in your clinical choices. With healthcare evolving at an unprecedented pace, the ability to critically assess information and apply it thoughtfully is one of the most powerful skills a clinician can have. By the end of this session, you'll see why evidence-based medicine is not just a practice, but a mindset that elevates patient care and professional excellence. Let's begin by asking the fundamental question: what exactly is evidence-based medicine? At its core, it is the conscientious, explicit, and judicious use of the best available evidence in making decisions about the care of individual patients. That definition may sound straightforward, but it carries profound meaning. Conscientious means being deliberate and intentional. Healthcare decisions are too important to be based solely on habit or tradition. Explicit emphasizes transparency. Decisions should be guided by clear reasoning that can be communicated to colleagues and patients alike. Judicious reflects wisdom, balancing evidence with clinical expertise, context, and practicality. Evidence-based medicine does not mean replacing clinical judgment with data or rigidly following every guideline. Instead, it empowers healthcare professionals to use high-quality research as a foundation while considering their own experience and the patient's unique circumstances. It's about informed decisions rather than automatic decisions. Imagine standing at a crossroads. One path is driven solely by intuition, the other by numbers alone. Neither is enough on its own. Evidence-based medicine is the bridge that connects these worlds. It ensures that every decision is grounded in science while honoring the art of medicine. This approach has become increasingly critical as the volume of medical knowledge grows exponentially. By mastering evidence-based medicine, clinicians can navigate this complexity, deliver higher quality care, and build greater trust with patients. It's not just a methodology, it's a mindset that transforms uncertainty into confidence. To truly understand evidence-based medicine, we need to look closely at its three foundational pillars. Think of these as the legs of a sturdy stool. Remove one, and the whole structure becomes unstable. Evidence-based medicine is powerful because it integrates scientific evidence, clinical expertise, and patient values into every decision. The first pillar is best available evidence. This means decisions are informed by data gathered from well-designed research studies, clinical trials, meta-analyses, and systematic reviews. High-quality evidence acts as a compass, pointing us toward interventions that are proven to be effective and safe. But it's not enough to simply read a study. The evidence must be critically appraised for its relevance, reliability, and applicability to each unique patient scenario. The second pillar is clinical expertise. No amount of data can replace the insights and judgment that come from years of patient care. Clinical expertise allows healthcare professionals to interpret evidence in context, anticipate potential complications, and tailor treatment plans. It is what transforms raw data into personalized medicine. The third pillar is patient values and preferences. This is often overlooked but absolutely essential. A treatment backed by research may not align with a patient's cultural beliefs, lifestyle, or individual goals. True excellence in medicine happens when evidence and expertise meet the patient's voice. When these three pillars come together, they create a balanced, patient-centered approach. Evidence-based medicine is not a rigid formula. It is a dynamic process that ensures care is effective, ethical, and deeply human. So, why evidence-based medicine matters today? The practice of medicine has always been a combination of science, skill, and compassion. But today, the landscape of healthcare is more complex than ever before. This is why evidence-based medicine is not optional, it is essential. With thousands of studies published every year, new technologies emerging, and treatment guidelines constantly evolving, clinicians face an overwhelming amount of information. Without a clear framework, it's easy to feel lost in the noise. Evidence-based medicine gives us that framework. It provides clarity and confidence by ensuring that every decision is rooted in trustworthy evidence, refined by clinical experience, and guided by patient priorities. In a world where misinformation can spread quickly and where patients often come to consultations armed with their own research, this approach reinforces trust in the healthcare system. The rise of complex treatments like biologics, precision medicine, and gene therapy has also made evidence-driven decision-making even more critical. Patients are no longer passive recipients of care. They are informed, engaged, and seeking proof that their treatment choices are the best available. Evidence-based medicine allows clinicians to not only provide the right treatment, but to communicate why it is the right treatment. Healthcare is also shifting toward value-based care, where success is measured not just by outcomes, but by efficiency, safety, and patient satisfaction. Evidence-based medicine is the bridge between scientific innovation and meaningful results. It helps ensure that new therapies are not only cutting edge, but clinically relevant, cost-effective, and aligned with real-world needs. In today's fast-moving environment, evidence-based medicine is more than a clinical skill. It's a professional responsibility. And as you know, in evidence-based medicine, not all evidence carries the same weight. To guide decisions effectively, we use a hierarchy of evidence, often visualized as a pyramid. At the very top, you'll find the evidence that gives us the highest level of confidence, and as we move down, the potential for bias and uncertainty increases. At the top are systematic reviews and meta-analyses, which pool data from multiple studies to provide a well-rounded and reliable conclusion. Just below them are randomized controlled trials, RCTs, often called the gold standard, because they minimize bias and directly compare outcomes. Now, let's talk about real-world evidence, RWE. RWE doesn't occupy a single level on the pyramid. Rather, it spans multiple levels depending on the source and methodology. Many forms of RWE, such as data from electronic health records, insurance claims, registries, and wearable devices, fall into the observational study category. Traditionally, this would place RWE below RCTs in the hierarchy, as observational data is more prone to confounding factors. However, healthcare is changing. RWE is gaining prominence because it complements RCTs by showing how treatments perform in diverse real-world settings that trials may not capture. While it may not always carry the same statistical rigor as RCTs, RWE adds contextual depth that's essential for personalized and value-based care decisions. Lower down the pyramid are case reports, case series, and expert opinions. These provide valuable early insights or highlight unique scenarios, but they're not strong enough to guide large-scale decisions on their own. By understanding this hierarchy and how RWE bridges evidence gaps, we can make decisions that are both scientifically sound and practically relevant to everyday practice. Now that we understand the importance of different types of evidence, let's explore how to actually put evidence-based medicine into practice. A simple and powerful framework to follow is called the 5 A's: ask, acquire, appraise, apply, and assess. Each step is a critical part of transforming raw data into meaningful clinical decisions. The first step is ask. Everything begins with the right question. Instead of a vague inquiry like, "What's the best treatment for hypertension?" we focus on crafting a specific, answerable clinical question. Tools like the PICO format, patient, intervention, comparison, outcome, help us define exactly what we're looking for, making the search for evidence much more efficient. Next is acquire. Once you have a clear question, you search for the best available evidence. This might involve reviewing randomized trials, systematic reviews, or real-world evidence sources like registries or health databases. The goal is to gather information that's both reliable and relevant. Then comes appraise. Not all evidence is trustworthy, and this step is about critical evaluation. We look at study design, methodology, sample size, biases, and the strength of the findings. This is where your analytical skills shine, separating high-quality data from weak or misleading results. The fourth step is apply. Evidence doesn't live in a vacuum. It must be integrated with clinical expertise and patient preferences. This is where decision-making becomes personalized, ensuring that the chosen intervention is realistic, safe, and aligned with the patient's goals. Finally, we have assess. This step is often overlooked, but it's essential. After implementing a decision, we review the outcome and process. Did the chosen intervention work? Could it be improved? Continuous reflection ensures that evidence-based medicine remains dynamic and effective. The 5 A's create a cycle of learning and improvement, helping clinicians stay agile in a rapidly evolving field. By following these steps consistently, you not only improve patient outcomes, but also become a trusted, evidence-driven professional. And when it comes to the role of evidence-based medicine in modern healthcare, we understand that healthcare today is more dynamic and complex than ever before. New treatments, diagnostic tools, and technologies emerge almost daily, and patients have unprecedented access to medical information. In this environment, evidence-based medicine is not just a helpful approach, it is the foundation of safe, effective, and ethical care. Evidence-based medicine plays a critical role in ensuring that medical decisions are rooted in scientific integrity rather than habit, tradition, or marketing influence. By systematically integrating the best available research with clinical expertise and patient values, it creates a transparent and trustworthy process for decision-making. This builds confidence not only among clinicians but also among patients, who increasingly expect care to be justified with solid evidence. One of the most important contributions of evidence-based medicine is its ability to bridge the gap between research and real-world practice. While randomized controlled trials remain the gold standard for proving efficacy, they often take place under highly controlled conditions. This is where real-world evidence (RWE) comes in, providing insights into how treatments perform in everyday clinical settings, across diverse patient populations, and over longer periods of time. Combining both sources of evidence ensures that decisions are scientifically robust and practically relevant. Furthermore, evidence-based medicine supports the shift toward value-based healthcare, where success is measured not just by clinical outcomes, but also by efficiency, safety, and cost effectiveness. By relying on evidence, clinicians and policymakers can allocate resources wisely, avoid unnecessary interventions, and improve patient satisfaction. Ultimately, evidence based medicine is more than a tool, it is a professional responsibility. It empowers healthcare providers to navigate complexity, respond to innovation, and maintain trust in a rapidly changing world. In modern healthcare, practicing without evidence is no longer an option. Practicing evidence based medicine is not just about knowing where to find studies or guidelines. It's about having the ability to critically appraise evidence. Without this skill, even the most extensive research library is meaningless because not all evidence is created equal. Critical appraisal is the engine that drives evidence based medicine. Critical appraisal means evaluating a study beyond its conclusions. It involves dissecting its design, methodology, sample size, statistical power, and potential sources of bias. For example, a randomized controlled trial might look impressive on paper, but if the study population doesn't match your patient population, or if the outcome measures are weak, its applicability is limited. Similarly, observational studies or real-world evidence can provide valuable context, but they must be interpreted carefully to avoid being misled by confounding factors. In today's era of information overload, clinicians and healthcare decision makers are constantly bombarded with new studies, press releases, and claims of breakthrough therapies. Without a strong understanding of critical appraisal, it's easy to rely on headlines rather than facts. This skill empowers healthcare professionals to separate reliable, clinically relevant evidence from flawed or exaggerated findings. For learners, developing critical appraisal skills also fosters a deeper respect for research and improves communication with peers and patients. Instead of simply quoting guidelines, you'll be able to explain why a recommendation makes sense, defend your decisions, and engage in meaningful discussions with colleagues. Ultimately, critical appraisal transforms evidence-based medicine from a theoretical concept into a practical, confidence-building tool that enhances care quality and strengthens clinical leadership. While the principles of evidence-based medicine are clear, applying them consistently in clinical practice is not always easy. Healthcare professionals often face real barriers that make evidence-driven care challenging. One of the most significant challenges is time. Clinicians juggle busy schedules, administrative tasks, and patient care, leaving limited time to search for and review research. Even when studies are available, the sheer volume of medical literature can feel overwhelming. Thousands of papers are published daily, and staying updated can feel like a full-time job. Another barrier is access to high-quality evidence. Not every clinician has subscriptions to major journals, advanced databases, or decision support tools. This makes it harder to find and evaluate reliable research. There's also the issue of skills and confidence. Not all healthcare professionals are trained in advanced research interpretation or statistical analysis. Without proper training, many rely solely on summaries, guidelines, or anecdotal experience, which may not always reflect the best evidence. Additionally, organizational culture can hinder adoption. Some healthcare environments prioritize tradition or rely heavily on authority-driven decision-making, making it difficult to challenge outdated practices. Finally, integrating real-world evidence into practice is still evolving. While RWE is invaluable for understanding how treatments work outside controlled trials, interpreting this data accurately requires both expertise and access to sophisticated analytics. Recognizing these barriers is the first step toward overcoming them. With education, leadership support, and better tools, Evidence-based medicine can become a daily habit rather than a lofty ideal, ensuring every decision is guided by quality, relevance, and patient-centeredness. The future of healthcare is being rewritten every day, and evidence-based medicine will continue to evolve as a cornerstone of high-quality care. The way we access, interpret, and apply evidence is changing rapidly thanks to advances in technology, digital health solutions, and data analytics. One of the biggest game changers is artificial intelligence, AI. AI-powered algorithms can scan and analyze massive data sets, from clinical trials to real-world evidence, in a fraction of the time it takes a human team. This has the potential to identify patterns, predict outcomes, and personalize treatment plans in ways that were unimaginable just a few years ago. AI doesn't replace the clinician's role. Instead, it serves as a powerful ally, giving professionals the tools to make faster, more precise decisions. We're also entering an era of integrated data ecosystems. Electronic health records, wearable devices, genomics, and global health databases are now interconnected, offering an unprecedented view of patient populations. This makes real-world evidence a critical complement to randomized controlled trials, helping clinicians understand not just whether a treatment works, but how it works across diverse demographics, healthcare systems, and real-life conditions. Personalized medicine is another frontier. With advanced analytics, we can move from generalized guidelines to truly individualized care plans tailored to genetic profiles, risk factors, and patient preferences. Evidence-based medicine is becoming less about applying broad recommendations and more about leveraging evidence to guide highly targeted interventions. The future also emphasizes collaboration and continuous learning. Healthcare professionals will need to stay agile, integrating new data streams and embracing digital decision support tools. By adopting these innovations, clinicians can deliver care that is faster, smarter, and deeply patient-centered, while keeping evidence at the heart of every choice. As we wrap up, let's pause and reflect on what evidence-based medicine truly represents. It is not simply a framework for reading studies or following protocols. It is a mindset. It's a commitment to approaching every patient interaction, every decision, and every strategy with scientific integrity, clinical wisdom, and respect for individual values. In a world overflowing with information, the ability to critically appraise evidence is a superpower. It allows you to cut through the noise, challenge assumptions, and ensure that every choice is guided by truth, not trends. The integration of real-world evidence into this process has given us even greater clarity, helping us understand how treatments perform in real-life scenarios, not just controlled environments. Together, traditional clinical trials and real-world data form a powerful foundation for truly personalized medicine. But evidence-based medicine is not a destination, it's a journey. It requires continuous learning, curiosity, and humility. Each day brings new research, new technology, and new challenges. Your role as a healthcare professional is not just to keep up, but to lead with knowledge, to ensure that every decision you make represents the highest standard of care. So, here's the call to action. Embrace evidence-based medicine, not as a task, but as a philosophy. Build your skills in critical appraisal, question the evidence, and advocate for decisions that are patient-centered, transparent, and backed by science. By doing so, you elevate not only your practice, but the entire standard of care for the communities you serve. Thank you, and see you in the next tutorial.